Dr. Aglo, please come and tell us what's happening.
Hey to you all and Happy New Year. I want to share knowledge on cancer. When you study and probably you have to learn something about cancer. So just like one person from the crowd to define cancer for us. And we have a definition for cancer. What's a cancer? What's a cancer?
Feel free to participate in any terms, as simple as you want to put it.
We learn every day.
Feel free to participate. Has anybody ever heard about cancer?
Cancer is an illness that affects the part in your body.
Okay.
In addition to what is everything, the analysis of the cells.
If you notice it early, if you know how to prevent it, if you do regular screening, you're going to prevent the disease. And if eventually it occurs, which we don't pray for, it can be managed at an earlier stage. And if you do it at an earlier stage, the treatment will be better. So here around Cameroon and other African countries, the most common cancers we find around the breast. You have cancer of the prostate, that indicates men, just the prostate gland, umbilical movement. You have cancer of the lungs, you have cancer of the liver, you have the colorectal cancer, it affects the intestines.
So should we sustain
And then you
it?
have cancer of the cervix. So these cancers that you will find most often around. Now, so like you said, cancer is
Good. I am, for those who were not here a few minutes ago, I am Elijah. I'm a teacher. I teach English and French. And today we are here to talk about cancer, which is far from what I learned in school. And we're talking about cancer because they don't talk much about it to you. When you put on your TV, what do you see when they're talking about AIDS, malaria, cholera, whereas there are certain specific things about cancer that we all need to know. The most important thing about cancer is that all of us can have cancer. And that there are many ways you can prevent yourself from catching it, because it cannot be cured. When it has already spread, the ultimate situation is what? Death. But before you die, if you suffer from cancer, before you die, you go through a lot of pain that even the strongest painkillers cannot help you not to feel the pain. So today we are from this organization called Celebrities for Africa. It is a group of cancer specialists who decided to come together and create this organization in the United States to help address this issue in Africa, because we don't talk about it. If I ask you, what do you know about cancer? Many of you don't know much. Am I right? Okay, you know something about it? So what we came here to do is just to share this experience, this information with you, so that one, you personally should be aware of the danger. Then you take it now back home, because you are not an island. You have parents, you have friends, you have neighbors, you have brothers and sisters, and relatives. So you take it back home to them and discuss with them. Someone said behind it that, no, if these brochures are for free, let us give him more. They are for free. And given that we would like you to participate very well during this show, we will have 5 t-shirts like that one, because we no more have this color. We'll have 5 t-shirts for you, for the best participants. So please pay your maximum attention. And to my left, please, let's get now down to business. We have two medical doctors here. And the one sitting is Dr. Kuna, she's from Buea. And the one standing is Dr. Ajong, and she works in the Buea Provincial Hospital and in Ebola. So please, I'll leave the floor to them to give you the facts about cancer. But remember, it's for you and for the people you love. Okay? So thank you very much.
Those who just came in, you're welcome. And before you came, the class helped me define cancer. And we agreed that cancer is growth of abnormal cells in the normal locations. So, beginning with breast cancers, it's the fast multiplication of abnormal cells at the level of the breast. And when we talk about cancer, you might feel that it really doesn't concern you because when you are young, there are so many things that you don't want to pay attention to. But let me remind you that as early as 18 years, and there could even be atypical forms before that, there are people who get breast cancers. So it's not so much of, it could be more in adults, old people, but it's also found in young people. And we believe in educating the nation. If we educate you this early, you will grow with the knowledge and you will do all that is necessary to prevent this cancer. And that's the most important thing. So anybody from 18 years and above can suffer from cancer. And unlike other diseases, the best thing with cancers is to detect them at a very early stage. Because it is only then that you can benefit from treatment to the maximum. When cancer spread very fast in their evolution, the treatment is no longer possible. We can only help you with symptomatic problems and in quotes, accompany you to death. That's what we can do. So it's better that you get these things early so that we can help you manage them. And then also, cancers cannot be treated when they are already spread to other parts of the body. There's what we call metastasis, like a breast cancer. It could be a breast cancer. And if not taken care of early enough, it will move to other parts of the body through blood spread, through lymph nodes, and will get to other parts of the body. Treating cancer can be so expensive. Because for the few centers that we have around here in Cameroon that can treat cancer, I tell you, you need a fortune to treat them. So, like they say, prevention is better than cure. It's better to prevent cancer than to get to cancer. Alright, now there are common symptoms and signs of cancer. We're just going to go specifically. We'll talk about, I was showing this picture to those who are around. This is an example of breast cancer. Sorry, this is somebody's breast. You see an ulcer here at the level of the breast. You see this hardening here. This is how far cancer of the breast can go. And so, what do we have about cancer of the breast? Okay. Alright, so when you get cancer of the breast, there are some common signs and symptoms. It could present with no sign, no symptom. That's when we say it's asymptomatic. But then there are some changes that will take part at the level of your breast that if you see, they are like a herald to the fact that you might have cancer. Again, they don't necessarily mean you have cancer, but it could be a sign of cancer. So to be forewarned is to be forearmed. You could have an abnormal feeling at the level of your breast. Every woman has a breast, and you know the way your breasts are usually. Feel abnormal, that one is very subjective. It's from person to person. Sometimes you can have a lump at the level of your breast. There's a lump that goes inside, which is usually not there, and there will be an abnormality. Sometimes at the level of your nipple, you can find changes. The nipple can dip inside, that's what we call nipple retraction. At the level of your skin, you can have some changes in your skin. Your skin just becomes different. You can have some small holes around it, like an orange skin. Have you all seen an orange? Sometimes that can be a sign of cancer. And the change in this breast, you only know that there is a difference in your breast if you know how your breast is usually. Your breast is yours. So we advise young girls to examine their breasts themselves like everyone in the world. And so we have early detections of breast cancers, like from 18 years. It costs nothing. You will not pay any money. You just examine your breast and touch it to see if you feel an abnormal lump in the breast. From time to time, you look at the breast to make sure that the skin is the same. So that as early as you notice a change, you can be able to report to the hospital and they will help you. And for people who are already between 18 and 39 years, we advise that you should make sure that a breast examination, a detailed one, is carried out from them like once in every year. And by the age of 38 already, you need to do, apart from the clinical examination, get your doctor to order a mammogram for you. A mammogram is an X-ray that looks at the breast specifically. So if you have the problem, you will be able to do it. And if you are between 40 and 49, you might probably need a mammogram every year, depending on previous findings. So at 38, if you are already going in for screening constantly, you'll be able to advise your mammogram. And now there is, to do a test of your breast, I would just like to demonstrate to you how you can test your breast. Now, you can take either the standing position or you take the sitting position. In the standing or the sitting position, you sit or stand like this with your hand this way, and then you can palpate your breast. Usually, to make it easier, you divide it into parts so that you make sure you examine every part. If you draw a line in the middle and horizontally in the middle, you divide your breast into 4 parts. Then you can go on feeling if you have any mass. This is what for all the 4 parts. If you have any mass, at the end of it, you express your breast. You press it as if you want to remove the to see if any discharge will come out. Normally, there shouldn't be any discharge. So if you find anything coming out like fluid, it could be clear fluid, it could be blood stains, then it's an indication that you should have a breast cancer. So you need to move to the next level. We need something very clear in you. We just came to make you know that something exists like that. And that if you notice it early, the chances for survival are higher. So you need to be alert, always check for it, always ask your doctor to examine you, teach you how to do the examination, and if she needs to go to a further level, to do other tests to like type the cancer. For example, if they do on palpation and they notice that you might have a breast cancer, they move over to the next step. They can do you a mammogram, like I said. They can do you an echography, an ultrasound of your breast. They can do you a biopsy. If there's a mass inside, they take out the mass, examine it in the laboratory to tell what kind of cells are there. That will tell the stage at which you are if you already have the cancer, and that will determine the kind of treatment you benefit. If it's very early, surgery could be possible. They will take off the mass, the breast mass, take off your lymph nodes from this level because these are the closest to the breast, and so they will spread the cancer faster. So they take off this and this. But at a later stage, surgery is no longer possible. You can only benefit from radiation therapy or from chemotherapy. And like I said, it is so expensive.
To know the causes of
Breast cancer.
Okay. Doctor, over to you.
Okay, thank you so much. There's no established cause and effect relationship between anything. For cancers, more of what we will talk about is risk factors, not really the causes. For example, for most cancers, including the breast, smoking is a risk factor. A family history of breast cancers, especially your very close relations. If you have a sister or a mother who has had a breast cancer before, you are exposed to breast cancer. And if an individual has had a breast cancer before, the risk of having another breast cancer is also increased. If you have benefited from radiation therapy of any kind, maybe to treat another cancer at the level of the chest, you are more at risk of breast cancer. So there are a series of things that when we find them, they are like risk factors for breast cancers, but there is no particular cause for cancers. When you have those factors in your family life, we advise you to do screening regularly so that if eventually you were to be exposed to it, you can get detected.
The other time, I heard some people saying that if women cancer. But you are not telling me that there is no particular cause for cancer. So I don't really know what you mean by saying that.
Where did you hear that, please? You heard it in the
I also
village.
heard it from people, from other people.
There are a lot of those things that are said but which are non-documented. Like using money in your breast. Well, I am talking, we talk with facts. That's how science is, alright? Yes, only research that has been done after theories and then the proof using a particular population is only based on that they will talk. So you won't hear me say anything that I have not read from a good, renowned book. Money in the breast.
Good. If the mother who is already infected with breast cancer, will it not have an effect on the child? Dr. Kuna? Okay, go ahead.
Depending on the stage of the cancer, but especially in early stage, it's not a problem because the cancerous cells are not within the breast milk. It's not like an infection, maybe like HIV that could go from mother to child, really, except it's already at a very advanced stage when it has metastasized and it's at the level of the blood. That's the only possibility. But at early stage, it's not affecting the child.
Next question. Okay, let us just talk.
It depends on the factor. I wish you ask that the risk factor doesn't mean it's a heredity, something that if a mother has or a family has, the other family has.
There is a hereditary portion. That's why if your relation, your mother, your sister had it,
one of the lines that I've gone through, I saw some of the risk factor when I call something like, if you have a close family member with breast cancer, you have a greater chance of developing the disease.
that's more of the hereditary factor. It's because if people have the same genes, genetic material. Hereditary.
Yes, next. The one in front, then the lady. Yeah, go ahead.
Pastor, I don't know if there's a particular group of people that easily gets infected.
Some particular group of people who easily get infected with cancer. Okay.
With respect to, can you be clearer? With respect to particular group of people, blood group, there's no particular blood group that is more susceptible. We are still towards the lung cancer. I wanted you to exhaust the patient.
So breast cancer question, yeah?
How long does it take?
2. Good. How long does it take, doctor?
Have a cancer and it manifests in 1 month, sometimes take years to get manifest. So it depends on how the kind of cancer you have. Just like in HIV/AIDS, you have 2 different types. Some are more
Rapid, they evolve rapidly
than
presentation
others.
than others.
So it depends. If you have a cancer, for example, it could just start like a little lump, but that's really a cancer. So other people, they have this scar that you saw in this picture. So it depends on the type of cancer you have. You can have a cancer evolve at any rate. Like it takes so many years, just like it will take no time.
Okay, 2 more questions for lung cancer, then we'll proceed. Good. Good. What about the tattoos? Good. He's preoccupied by Lil Wayne. Lil Wayne is an artist, and all over his body, he has drawn tattoos, and so can they give him cancer? That's the question. Good.
Tattoos in themselves, no. Now, tattoos could constitute a health risk depending on how they draw them and what they use to draw them. Sometimes they could be these sharp objects, which involve piercing. So then they will cause transmission of diseases which flow in the blood, but for cancer. So.
Okay, question. Let's take that young man there. Please, volume.
Not always. Like we said, surgery that is asking that he has always been getting the information that those who have breast cancer end up having their breast cut. Like we said, it depends on what stage. When they cut off your breast even, we think that it is better for you. But they can surgery is only an option when they discover it early enough. Because if it's not early, it means that the cells are spread to other parts of the body. Even if you cut off the breast, the cancerous cells are still in the system. So it doesn't make sense. Late stage cancer is not
Good.
One of the things that
No, please.
breast cancer,
She will answer.
when many boys touch your breast,